Hi, it's Dr. Travis Howell here, pediatric chiropractor in Bettendorf, Iowa. Coming up right after this little intro, we have our ADHD workshop. So whether you came to the live version and you're just watching this recorded version to pick up a couple things you missed, or if this is your very first shot at watching it, I encourage you to have a pen and paper ready and take plenty of notes, because this workshop is loaded with information and answers for you to help your kids successfully manage, or yourself successfully manage, ADHD and give yourself the brightest future possible. ADHD, okay, we're gonna go through the causes behind it, how it develops, and then, what are our options to really take a hold of it and get successful management of it, okay? Where does it really come from, and then what can you do about it? All right, this is me. I'm a pediatric chiropractor from right across the street. Those are my 3 kids. Dog not pictured, but that's a little bit about me. And our focus over there at the office, just to give you a little background of who's the guy talking to you today. We do specialize in our pediatrics and prenatal and family wellness, and then we see people for a whole host of reasons. Actually, one of the reasons I was late today is because one of the kiddos we just got to see today, last minute thing, had just spent 4 weeks in the hospital with meningitis, so we work a lot with a lot of nervous system challenges, okay? So, my perspective tonight, as you saw there, I have 3 kids, but none of these kids have ADHD. Okay, so my perspective is not that of a parent to a child with ADHD. It's more from the perspective of a provider that works with children that have ADHD. Even adults. I have some adults that come see me that have ADHD as well. So that's my perspective. Okay, there is definitely a wide variety of people that come to these events. Okay, some of you, it's really, really severe challenges that you're facing at home, and I'm going to do my best to really harness that and understand it the best that I can. And then it's just a little different for everybody that comes to these. So my goal is always to give you the most amount of information possible, so that when you're making your decisions when it comes to ADHD, it's a really, really informed decision. Okay, you have all the information available to you. All right. So first, we'll start out with what's the actual definition here of ADHD. And it's, if we go by the letters, it's attention deficit hyperactivity disorder. But from what we can tell and from what we experience with these kids, is it's really not actually just a deficit or a disorder. We wouldn't classify it as either one of those two things. The majority of the kids that come see us, when we talk to their parents don't see it as a deficit or disorder either. Okay, if you guys have kids with it, these kids are rock stars, right? And every single time that I talk to a parent about it, they know their child wants to and can achieve more, and there's just a missing piece. Something isn't making sense, something isn't connecting. And so that's why they come see me, and that's really why we are going to have this talk tonight. But we can compare it to, right here, a Ferrari engine with bicycle brakes. Okay, so you can imagine, if you're driving down the road with that, that's going to be a little dangerous, right? It's going to be a little hard to control, a little hard to handle. All right? Has 2 components. They go in order, and there's really only these 2 components when it comes to ADHD. First, they're stuck in something called sympathetic overdrive, which we're going to talk about, and now we've got this overdrive, and it's poorly organized. It's an effort from the nervous system that doesn't really make sense. It's disconnected from reality, okay? And they have to be addressed, and they have to be addressed in that proper order, okay? A lot of times when we're working with these kids, one of the quotes we're going to cover later is the function of the nervous system is to perceive the environment and then coordinate the behavior of all other cells. So it's going to perceive the environment you're in, and then it needs to coordinate the response that you have to that environment, okay? So when we look at this, a lot of times when we're looking at managing ADHD, we always go after the behavior first. A lot of these kids are already going to be seeing somebody for the behaviors that they have in school, or the behaviors they have at home. They're not actually seeing anybody at this point when we talk to them about what's behind that. Why is that behavior occurring? And it's really because there's a disconnection in their perception of reality. Perception of their environment is not correct. Okay, it's not organized. It's not coordinated. It's too high, and it's just wrong. So we're going to talk about how to harness that, how to get that perception back to what optimal perception. Okay. And then we talk about behavior. Okay? So, sympathetic overdrive. Here we go. Nervous system is made up of two parts. We got the sympathetic side, we've got the parasympathetic side. But for today's purposes, we're going to call the parasympathetics the brakes, and the sympathetics the gas. So you can think of the gas, this is your Ferrari engine, okay, when we're stuck in sympathetic overdrive. So our Ferrari engine's working really, really well, best in the world. And our brake pedal's not working at all. Okay, so we're losing that balance. You can't be in both of those at the same time. It's just like the brakes in your car. If you push on both of them, your car's going to make a lot of noise. It's not going to go very far. Okay? So the same thing happens in the body. When you push on one, the other one essentially shuts off, and vice versa. It kind of goes back in that fluctuating pattern. Okay? Well, why is this important to have a brake pedal? This is, when we're looking at kids, this is our growth and development phase. This is our immune system, our digestive system, our endocrine system. This is where we should spend most of our childhood, over here. Okay? We should spend it in that growth and development. But what happens is we get stuck over here in survival. Survival is designed to be short term. Think running away from a tiger. Okay? Think about primitive times you walk down the Mississippi to get some water, and a tiger jumps out at you. Just imagine there's tigers in the Midwest. Okay? The goal of that is survival. To get away from that tiger, to get to a better environment so that you can survive. It's not designed to be in all the time. Okay? Then you can start to see where they're constantly running from a tiger. They can't behave well, they can't perceive their environment well. Okay? So when we measure this, and one of the ways we're going to do this is we're actually going to measure the total energy coming out of the system. Okay, so we can actually quantify exactly how much energy is in that system, and we have a normal range for that. It should land within a normal range. That normal range is 100. This little slide right here is a little over 300. And so what happens is we have hyperactivity, we have impulsiveness, we have behavior issues. What you can think about this is Metallica. Okay? Imagine wearing headphones with Metallica blaring in it all day. You're not going to be able to follow directions. You're not going to be able to learn very well in school. You're certainly not going to be able to take a test. James Hetfield, I think is his name, that's the lead singer. He'd be screaming in your ears all day. Okay? So you now have to process that information all while you're trying to perceive your environment. You've got this noise just going. Okay? So we got to figure out how to turn that noise off. So at 394, there's too much noise. And normal is 100. Okay? So the second step then is when we have all this energy, if it's not coordinated or organized, then we're going to have some issues. Okay? Then we're going to have more of the bad behavior, and this is that second phase. But here's that quote I showed you before. The role of the nervous system, perceive the environment, coordinate the behavior of all the cells. This is Dr. Bruce Lipton. If you guys do a lot of research on this stuff, Bruce Lipton is an awesome person to look at. So this leads to your attention problems, your confusion, your organization issues. This is really where they get their challenges with social interaction, their school. Maybe they have some coordination, actual coordination, like physical coordination challenges. And then, like speech and those kinds of things are slowed down as we go through this process because they're listening to Metallica and that's not really conducive to speech. Okay? He just screams into a microphone anyway. So they're losing that developmental step, essentially. It's being pushed down, pushed back a little bit. Okay? So what you'll see on this one is actually a pattern score of all these numbers should be 100. So a pattern score really, really low shows us that it's disorganized. So we're actually measuring how the pattern looks within that nervous system. Okay? So our first line of defense when we look at our first answer, let's say, when we look at ADHD in our society, this is 2/3 of all children that are diagnosed with ADHD are put on some type of a medication. Okay, that's more than 4 million children in the United States are put on some type of a medication. Most of those are stimulants. Those are the Ritalins, Concertas, Adderall, Focalin, that's all those. Okay? Now, those drugs are stimulant drugs, and they're the same. They're a Schedule II controlled substance, the same as cocaine, methadone, methamphetamine. Obviously in different doses, but it's the same exact drug. Okay? The goal of these drugs is to boost dopamine and serotonin, which are brain chemicals that actually give you that sense of well-being and that sense of calmness or relaxation. So it takes you from this excited level, and it's going to stimulate, or it's going to mask or reproduce the same response that those two neurochemicals would give you, but it's giving it through a pill, okay? So most of the society, I mean, most of us as just going along with what the doctor says, would think, okay, that's, there's a deficit there, right? Well, the challenge with it is if we look at the actual physician's best reference, which is the PDR, it's what any medication has a list of how it should be prescribed, how it should function, okay? These are the 4 main points out of it. There's no evidence of how it works, why it works, or what the long-term effects of the nervous system are when we take those stimulant-type drugs. It should not be used on children under the age of 6 because there's been no safety or efficacy studies done. The long-term effects of it are unknown, and it suppresses growth, and that's been reported. They don't actually have a study on that. It's just case studies. They don't have a research part. It's just what they've noticed over the course of having it out for the last couple decades, that suppressed growth is a side effect of it. Okay? So you would hope that we follow those rules as a society, and unfortunately the fastest growing population on those psychotropic drugs is 5 and under. There's a 369% increase. So if we go back to the PDR, number 2 says, should not be used in children under the age of 6. And the number 1 population is children under 5. The biggest growth population, okay? Our current numbers here are in 2014, it's about 10% of boys and just over 5% of girls are on a stimulant type of drug. And here's a couple names on the left. We've got Einstein, Kurt Cobain, Edison, Bill Gates. I think all of you guys have heard all those people. You've definitely heard of Einstein, Edison, and Bill Gates. If you haven't heard of Kurt Cobain is the lead singer of Nirvana. He was diagnosed at a very young age with attention deficit disorder. His kindergarten teacher was reported saying he would never pay attention in class. He would just sit in the back of the room writing music in kindergarten. Can you imagine how much energy this guy had, how beautiful his mind was? And our answer for him at the time, our answer was, well, we put him on a medication when he was in elementary school. Okay? Kurt Cobain literally changed music. I mean, Nirvana was like a band of its own. It's this brand new band, a brand new type of music. There wasn't anything like it before, right? He was a genius, okay? As were these other people. And unfortunately, he became addicted to this drug, and this is the actual drug that ended him, that he overdosed on, that his life came to an abrupt halt in his, I don't know the date, but I think in his 20s. So the question that we have to really figure out is, are we trying to put a square peg in a round hole? What is our goal when we meet someone with ADHD and we're trying to manage that condition and help the families better experience it and better successfully manage it? We really have to figure out what's going on and really whose purpose are we serving? Are we serving the purpose of our child or of our round hole that society wants us to fit into? Okay, so that's going to be part of the challenge that we have to face, and we just want to keep that in mind as we're going through all of this information. But it leads to the question of is there a better way to juice up the nervous system? Those drugs, those stimulant drugs, design are to juice up the nervous system essentially. And there's no really better word for it. It just does that. Okay, it releases those neurochemicals and gets the nervous system more excited, which is going to actually, sounds kind of counterintuitive, but as it excites the nervous system, it helps you focus. Okay, think of caffeine on a day when you need a little bit extra focus. You're going to have something like caffeine. Okay, and before I answer that question, I want to take you through a couple other things. There was, I guess, essentially a survey or study done where they really wanted to figure out why is there this rise in prescriptions? Why is there that 369% rise? Why are there now 4 million children, over 4 million children on these stimulant drugs? But back in 1996, there was 1 million and they were concerned. And now here we are almost 20 years later, there's over 4 million and we still haven't really figured it out. Okay? The results, well, we're making better drugs and we're making more of them. So that makes they're easily available. the society accepts it. You know, like now when there's a line of kids at the nurse's office in the school, it's acceptable. It's no longer a new thing. Okay. One of the articles we used to have in our presentation was from 1996, where they were concerned at that point because 12 kids were standing in line at the nurse's station for their morning dose of Ritalin, and now it's multiplied. And then managed care, it's a lot easier with today's healthcare. It's a lot easier and cheaper to keep somebody out of the doctor's office and just give them a prescription than it is to really figure out what the whole picture looks like. And so that's one of the reasons they give. And then the last one, which is the hardest one to swallow, is as a busy parent myself, which you obviously can see is behind a lot of times. Busy parents was another one, and we're going to dig into that a little bit later here. And then we look at the top 17 prescription drug abuses from 2013, and all three of them are on the list that we just gave you. Number 3, number 5, number 8. Okay? So there's a real problem here. We gotta figure this out. And a passion of mine, I guess you would call it my why. Why do I care so much about this presentation? Why do I care so much to be here with you guys, teaching you guys this stuff while my 3 kids are chilling with grandma and my wife's here? Is because when we look at the last 20 years, every single problem we've had, whether it was in a school or a military base or wherever, anytime we've had a significant mass shooting, it's every single one of those kids has been on, or not all kids, every single one of those kids or adults has been on one of these 3 drugs we just listed on there. Okay? So, including somebody in our family that was at the Sandy Hook Elementary School. So it's near and dear to our heart. It's something that we take very seriously, and we're here to give you answers. So that's what we're going to do right now. The spine is more than just bones, muscles, and ligaments. Okay? It literally houses our life. We've got something in there called the nervous system. The nervous system controls 100% of everything you do, you think, you act every single day. Okay? It perceives your environment. It coordinates every one of your behaviors, every one of your thoughts. It's everything. Okay? It lives inside that spine. Kind of important. Can you guys agree? You can answer, even though it's recording. So I am a chiropractor, and these are the 3 principles we really live by. Okay? Your body's made to heal, and it's meant to be well, not to be sick. The nervous system controls literally everything. Number 3, interference is called a subluxation, and that causes dysfunction within that very system. So our goal is always to locate number 3 so that number 1 works. Okay? There's 3 main components to this. We're going to really touch on the first one a lot, and that is misalignment. Okay? The misalignment is really the bread and butter of what you go to a chiropractor for. If you go to a chiropractor, you're most likely going to get adjusted. Okay? And this is why. Because you've got a misalignment and a fixation within the spine. It should look square like this, and it looks off like that. It's causing a lot of compromise within the nervous system. Why we have the top one on here, the top vertebra here is very close to your brainstem. Okay? Your brainstem houses something called the vagus nerve nuclei, so it's the control center of something called the vagus nerve. The vagus nerve means the wanderer. You guys have ever heard that before? It literally goes from your brainstem all the way down to your diaphragm, all the way back up to your brainstem again. Okay? It controls many, many things within the body. And so if we have a subluxation there, it's very crucial, it's very detrimental to our overall health, especially when we're talking about ADHD. So usually, it starts here, okay? When you think of birth trauma, this is about, well, I'll give you the stat in a second. Nearly half of all births in the United States are C-sections. Here in the Quad Cities, it's only about 30%, about 30%. But the World Health Organization say 5% are necessary to save either one's life, either mom or baby's life, or there's something else going on. But they say about 5% are medically necessary, and we do over 30% here. In the average, just normal vaginal delivery, there's 60 to 90 pounds of pressure put right there on that spot that I showed you. So you can think about, this little guy right here probably weighs about 60 pounds. If I were to pick him up by his head, I'd be over, right? Dad would take care of me. And I just wouldn't do it, right? I wouldn't do it to my own kids, I definitely wouldn't do it to your kids. But that's how we're bringing them into this world. So there's definitely a challenge within that birthing arena, and obviously nothing that I take care of. But the importance of it is what needs to be done after that process is experienced, okay? After the birth process is done, that's when we really need to start looking at what do we do from here. A study done way long ago, this is actually in the 80s, that he saw that spinal injury, Dr. Gutman said, spinal injury was present in about 80% of all children, okay? And he went on to say, he's an MD, he's the MD up there, used the word subluxation, and said after all births, they should be evaluated and adjusted by a chiropractor if necessary. Because he understood how much pressure, how much tension was put on that upper cervical region, which is very, very important to our overall health, especially when we're talking about neurodevelopmental disorders. When this is more of a staff for autism, but I just wanted to put it in here just so that you guys understood as parents, you're going to make a lot of decisions in life, and I don't want you guys to beat yourself up over this. This presentation isn't about right versus wrong, but when we look at what are our best indicators that we're going to have develop autism, okay? Our best indicator is that we have an identical twin that has it. Our second one is cerebellar injury at birth. You see all these other ones that are all over the media getting blamed for autism? Like the MMR vaccine, population, mother was older than 35, dad was older than 40. You hear all those things, right? Well, none of those things really have anything compared to really that cerebellar injury, that brainstem and cerebellar injury at birth. Okay, so it's a very, very important part of the nervous system that we got to start looking a little bit more into. And he considered it, you know, an undertreated, most significantly undertreated part of the population. Now, this one, he might not want to watch this. This is a video I'm going to show you, okay, of exactly what this looks like. A picture is worth 1,000 words, a video is worth at least 10 million, but it is very graphic, so it's completely up to him and you guys if he wants to watch this. But this is a baby being born C-section.
Irritated.
Apparently without sound. Oh my gosh.
Oh, there you go.
Come on, buddy.
All right.
This is a vacuum extraction, and then I want you to look at what they do to me.
Here's little girl. Make you cute for the camera.
Oh, man. Keep coming back.
There you go.
So that is normal. That's the way we deliver babies in the United States of America. Okay? It's a problem. I'm not going to fix it today, but I want to fix the result of it. Okay? I want to help with that problem after that's been done. Okay? When I get kids in my office, that have ADHD, we draw a picture of their history all the way back to that moment and a little bit before that moment to figure out exactly how deep into the nervous system is this challenge, okay? And almost, I would say, over 95% of the time, it started just like that. Life started like that, okay? It's not mom's fault, it's not dad's fault, it's nobody's fault. It's a fact that we have to know and we have to use as we're now going through our normal diagnosis and care plans, okay? But even a totally natural, uncomplicated birth can result in subluxation. We just had a wonderful baby 3 months ago, almost 4 months ago, and I adjusted him within hours of being born because he had the same thing, and he wasn't born C-section, and mom did awesome. But it was still there, just because you can think of this baby, 9 pounds and how many ounces? A lot of ounces. Being in this small area, it puts a lot of stress on the spine, so it's something that definitely needs to be checked. All right. So, as we go through this subluxation process, don't remember these words, but I just want you to remember the process. There's 4 main words here that happen. First, we have the misalignment and the fixation. Then, the communication from the brain is altered, okay? Which leads to that sympathetic overdrive we were talking about. So that's how we get to this point. After that sympathetic overdrive has been there, we have abnormal output. So then we have the behavior problem. Then we have the symptom. We have all the problems, right? So instead of starting with the problem, we need to start with the source, right? This one really talking about the function, why we need to remove those fixations in the spine, because the actual movement of the spine is 60% of your brain's batteries come from that movement of the spine. Okay, so we want that to be organized and efficient. Our spine has to move. Okay, and that's why we need to correct those fixations within that spine. And chiropractic, why chiropractic works, all those 4 things I just listed to you. It restores proper alignment and movement, that's that first D. Then it restores proper incoming flow. So the communication between the brain and the body, it balances that sympathetic overdrive. So it creates more balance, more communication within the body. And then it restores that normal energy output. Okay, so that's why I'm here today. That's why we are talking about this. And this is how we find it. So this is not the way we do the energy one, but this is the way we do another one. It's similar to this. This is a thermal camera, essentially. And it's safe. It's not painful. It's really non-invasive. I mean, everything's done on the skin with the gown on, so it's really quite an easy process. And NASA uses it. Same exact technology I have in my office, same exact machine I have in my office to evaluate the function of their astronauts before and after they go. So it's some pretty cutting edge stuff. Now, beyond chiropractic, there is more to this world than chiropractic. I know, sorry guys. I'll tell you what it is. Oops, wrong button. Alright, so the first thing is exercise. We gotta get these kids moving. They've got more energy than the average neurotypical kid. Doesn't necessarily mean it's a problem. We just gotta figure out a way that we're gonna harness it, okay? The chiropractic process is gonna make it more organized, more efficient, but we still gotta figure out a way of getting rid of it. So we gotta get them building forts, climbing trees, kicking the ball, all in about 1 month, because it's still too cold outside, unfortunately. And exercise almost immediately elevates those neurochemicals we were just talking about. So we can actually, without the use of medication, stimulate those exact drugs that we need, or neurochemicals. We can actually stimulate those to balance that nervous system, all just by playing kickball and football in the yard. Okay? So we just got to get them out and get them moving. During the winter months, we got to be creative. We go to the Y, go to the family entertainment center, or whatever that's called over there on John Deere Road. All kinds of stuff. Build some snowmen, go sledding. I don't know. Just figure out a way to harness or to expend this energy. And then we got to figure out some neural integration, exercise, and therapy. I know some great people that you can go to for this. ADHD is a label. Okay, it is one of those labels that we give to kids. Really, all these neurodevelopmental disorders could really just be labeled under one thing. It's really a sensory processing disorder. Your senses aren't processing the information they've been given. It's just not functioning right or properly. So that's really where this integrative therapy can help. Honestly, by the time most people come to me, they've already done this, but I need to tell you this. We're going to name our office the Last Resort Chiropractic, because that really is when people come see us, and they give me 5 minutes to help them. So, but this is good. This is good. If you need a place to go, I can send you somewhere, for sure. And obviously when we're working together, like when I'm working with someone that's going to an OT or a PT or a speech pathologist, it really is me plus that therapist. Really, 1 + 1 does equal 11. It's not a 1 + 1 = 2. It really multiplies tenfold. That working together to help these kids is really going to be spell the best results for them. Okay. Then we need to look into their environment. What's their environment look like? What are they putting into their body? What are they surrounded by every single day? Okay. And specifically, when we look at ADHD, we have some diet issues. Okay. This is 2 cups macaroni and cheese, 1 small bag of Skittles, and 8 ounces of orange crush soda, which you would probably see a big percentage of our children eating these days. This has 102 milligrams of artificial dye. It takes 20 to elicit ADHD-like behavior. So imagine if you eat this more than 1 time in your life. You're every single time putting 5 times the amount of petroleum, is literally what it is, in your body. Unnecessarily, okay? So, and then pizza, I like pizza, so I won't be on that one. Okay, so what should they eat? Well, real food is a start, okay? Obviously everybody's going to snack at some point, and we're going to have some cheating, but we really need to follow the 80-20 rule, 80% of that being real food, 20% of the time they can go to grandma's. Then we have a paleo diet, which is really meat, fruits, veggies, that kind of stuff. Think of like a caveman, primitive type diet. Then we have something called the Feingold diet, which was actually developed just for behavioral disorders, and it really removes all those food dyes, and it's going to remove a lot of things like gluten and a lot of the stuff that your body doesn't necessarily need. It causes an inflammatory process, and as inflammation goes up, so does your sympathetic response. Okay, so now as your body's becoming more inflamed, you're going further into this sympathetic overdrive. Okay, so you have to cut that stuff out to help give yourself the best opportunity to manage this. Okay, sugars do the same thing. A study here, and actually they did this study in, I feel like all good studies are done in Europe first, and then we get them like a couple decades later. But they did a study where they were really just testing omega-3 fatty acids, and they had a group of children that were labeled essentially as ADHD, and they gave one group omega-3 fatty acids, is the only difference, and the other group they gave a placebo pill, okay? And the group that got the essential fatty acids got better test scores. So it actually allowed them to access their nervous system a little bit better, a little bit more coordinated. Doesn't make them, it doesn't raise their IQ essentially. It just helps them access their IQ, okay? And then, this is probably the biggest one that I see now. I mean, I have kids that come into the office, even after I tell the parents this very stat and information, who I have to wait to adjust them because they're still playing their game and they don't want to end it. So, they're literally tied to these devices. I mean, like, I think I know Text Thumb got an official diagnosis a couple years ago, and I'm sure the neck is to follow very soon, where Mom covers it up. I'm not judging, it's okay. The reason technology works so well for these kids, and the reason that they can't pay attention in class and they don't listen to what you tell them to do and you're telling them directions, and they can't process this information, is because it's just too much going on. Okay? Well, the only thing really that we have in our world that's faster than their brain is our new technology. Okay? So this actually helps them calm down because it's going so fast that they can actually connect better with it. All right? It doesn't make it right, and we need to figure out why their nervous system's going so fast, which I think we just essentially went through, right? So if we really gotta work on limiting their screen time. I'll just skip right over that. I just like that picture. So this leads to my next, the more difficult one. Okay. When we look at this, really a big component of this comes in. Remember earlier in the presentation I told you that one of the number 4 reason medication prescriptions are on the rise was because of busy parents. And so this is really a key part of it, okay? Again in Europe, they actually require the parents to go through parent training for any child diagnosed with ADHD. Because what happens is, and our family is just as guilty of it as any, we are literally on the go 24/7. Okay, we had a weekend this weekend where we didn't have to do anything. So I thought, awesome, I don't have any home projects, I don't have anything to do, there's no football on TV, I can just relax, play with the kids, and we went to IKEA. So, that's in Chicago, in case you guys didn't know, 3 hours each way. Alright, so we're just always on the move, okay? And so what we have to do is, if we're always doing that, you gotta think, your child is in that world too, if you're taking them with you, okay? So they're always gonna be on the move, constantly going from one thing to the next. I try not to say it anymore, but I yell at my kids, hurry up, let's go, right? So we're constantly getting them to try to speed up life, and that is just feeding into this nervous system even more. I do have somebody to send you to, so I have a business card if you need it, okay? She specializes in parent training. Once we get to these kids to a point where the nervous system calms down, they have learned behaviors, and you have learned responses to this activity. So both of you need a little bit of help to overcome those learned responses and learned behaviors, to make sure that we're going to give these kids the best success when it comes to management of it long term, okay? Because if they've constantly been shaking their leg in class, or if some kind of stimulus in their classroom always sent them over the edge, that's a learned behavior. So now when they get that stimulus, even if it doesn't overload their nervous system, they're already going to respond to it the way they've already learned to respond to it. That makes sense? It's kind of just like Pavlov's dog would ring the bells, mouth waters, okay? Same thing happens. Even after you remove the meat from that situation, every single time you ring the bell, the dog's mouth still waters. Right? So we have to break that habit, and that's good. That takes both parents and the kids. So I'm almost done. Don't worry. To sum it up, we really have a 7-step process here, but there's 2 main components of ADHD. Okay? Sympathetic overdrive, that disorganized nervous system, and your spine is stuck in the middle. Your spine is really that middleman of that whole process that has to house this whole power source, and it really has to function as well as possible if we're going to get the proper function out of the nerves that live within it. Okay? Oh, you're smiling at me, I don't know. Okay. If your I like this one too. If your spine was on your face, you take a little bit better care of it. So just like your teeth, you brush your teeth every day because you see them every day, right? Same thing goes with your spine. If you could see it every day, you take a little better care of it. So this could be many of you in the room. This could be, some of you guys are providers. What do you do? So the first thing you're going to do, the number one thing I think anybody could do is really have their nervous system fully evaluated by a pediatric chiropractor. Okay? Obviously in the Quad Cities, you might as well just come to me, but if you want to go, you just got to find somebody that's trained in this exact information, this exact technology. Okay? We need to find what the neurological components of that subluxation are, what the neurological components of the ADHD for that particular child are, and we need to get it balanced. Once we get that balanced, or as we're getting that balanced, you need to start doing those other things. You really got to work on some neuro-integrative exercises. Okay? So now we're creating a better environment for that nervous system to learn and create new habits. So now we got to train it. As we're reorganizing, we want to make sure we reorganize it the way that it should be, the most optimal way possible. And that's where your therapists are going to come in. We have to eat a little better. We got to make our environment a little bit better. Okay? We also can introduce things like essential oils. If you've heard of any of those, I'm actually going to have a workshop in my office with Jenny here. She's an essential oils lady. I don't know a lot about them. I know enough about them to tell you what they are. So she's going to come and teach my patients a lot about essential oils. You guys are welcome to come. Just give one of the girls your information back there. It'll either be Monday the 16th or Thursday the 19th. They're still working on a little bit of details there, but that can help out a lot too. Okay? There's really 5 supplements here, but really 3 of them are really the most important for everybody to take. Fish oil, as you saw, there's a study with the essential fatty acids that fish oil helping kids with ADHD. Probiotics are really going to help with that digestive tract and that portion of the body's function. And then vitamin D is really just the ultimate supplement. In Iowa, we're really not getting enough vitamin D, especially now. We haven't seen the sun, our skin hasn't seen the sun anyway, in about 4.5 months. So we're getting to that point where everybody here is deficient in vitamin D, and there's no possible way from April to August you can get enough to hold you over for the rest of the year again. So vitamin D is an important one, and a couple others there. And we need to get that exercise. We have to let them play. We got to figure out a way to get out of the car seat, to get out of the swing, to get out of off the couch. You can enroll them in stuff like martial arts is really awesome. It's a disciplined sport. It helps them expend a ton of energy. Swimming is another one. Get them in something that's a team event, or something organized, right? That's a disciplined event, so that they have a coordinated play time, essentially. Get rid of the electronics as much as you can, except for that guy. He's cute. And then, really, the last thing is this is a process to get here. Okay, especially when we tie it all the way back to birth, and the average age of the kid that comes into me with ADHD is over 7. We've got 7 years at least of work to do to help balance this out. Okay, I do get them younger sometimes, which is awesome. But we really got to trust the process. Know that it's going to be a process. Okay, know that relearning our nervous system and re-educating our nervous system is a process. So you just got to trust the process and go with it. And go in with this, continue it with the same gusto you came into it with. Okay, and give it the time to really manifest. And back to number 1, because literally it's the most important thing you could ever do when it comes to these kinds of things, is really balancing that nervous system. You gotta check it first. We don't know if it's not balanced until we check it. Okay? A couple of these things I want to show you. One of the things we're going to test in the office is anxiety levels. Okay, so you can see in this scan, this is something called heart rate variability that we do in the office. It's really overall, from an entire population standpoint, the number one indicator of how healthy you are is your heart rate variability. But if you look at this blue line right here, this is your anxiety level. So you can see this kiddo's anxiety level when he came into the office the first day. And then you can see what it was after only 2 months. Okay? Anxiety level just way down. Okay? That's obviously something that these kids are suffering from when it comes to that stress level, that anxiety level. And here's another one. When we're looking at that total noise of that Metallica, we've got a total energy score that started out at 242, and this was in June. And by August, it was already down to 138. So really harnessing that energy and getting it to calm down, pumping those brakes. You can think of it like analog brakes in your car. Like today, you're driving on ice. Somebody pulls out in front of you, you hit the brakes, your car pumps now, right? We have fancy brakes. So the same thing we have to do to the nervous system. We got to pump those brakes as much as we can to help it slow down. Because if we just lock them up, that's not good for anybody, right? You're going to lose control. Okay? So, many of you might be wondering this, if this is really the answer, or if this is the next step in your process to help manage ADHD a little bit better. And so what we do is we always give you an opportunity. This is obviously put together with the National Wellness Foundation. So we have a little opportunity through us and the National Wellness Foundation to come in for that initial evaluation. Okay? In the back there is a packet. I don't think she gave it out yet. No. In the back there's a packet. It's a few pages long. It's really going through the exact same stuff I just told you on here. It's just a little easier to digest because you can do it at home and read it and refresh your mind on this information we discovered. But as you pick that up, if you're interested, I want you to talk to Denise and Lisa back there about scheduling an exam to come in, okay? It's a two-step process. The first day you're going to come in for the exam. We're going to gather all the information we possibly can. We'll send you home. And we'll look at the information, really figure out what's going on, kind of dig into it, match it up to your intake form, your history, all that stuff. Really formulate the best care plan I can come up with for you. Then you'll come back the next day or so, and we'll go over that. You know exactly, can we help? Are we one of your options for help? Okay? How long is that going to take? What's the investment in that stuff? Okay? So, and the time is now, because there's no better time than now.